Hey guys, welcome to my video on thyroiditis. And before I start off with my classification and diagrams, I'm just going to go over a few quick definitions. So remember that a thyroiditis is an inflammation of the thyroid gland, and sometimes associated, not always, but oftentimes is an enlargement of the thyroid gland called a goiter. When we talk about inflammatory markers in thyroiditis, we're focusing in on the ESR and the CRP. A hyperthyroid state is one with palpitations, weight loss, anxiety, and a hypothyroid state is one that's associated with weight gain, hypercholesterolemia, and remember the decreased relaxation phase of reflexes. So I'm going to start off by dividing our thyroiditis by the presentation of hyper versus hypo. So when you have hypothyroidism and there's inflammation of the thyroid gland, you're thinking of Hashimoto's. In terms of hyperthyroidism, presentation in an inflamed thyroid gland, you're going to divide it up into the presence of a painless and a painful goiter. And the name says it all, a painless inflammation of the thyroid is painless or silent thyroiditis. A painful thyroiditis is subacute. And in this, it's painful, it's actually tender. So that's a better word. Painful or tender thyroid gland is going to have increased inflammatory markers. So this is another distinguishing feature. And remember that in Hashimoto's, you have lymphocytic infiltration and fibrosis. And it's an autoimmune disease. Painless or silent thyroiditis is also autoimmune. And subacute is post-viral. Another thing I want to point out is the duration of symptoms. Hashimoto's is a chronic, more chronic presentation, whereas the hyperthyroid presenting thyroiditis are more brief. Also, and my last point is, this is more of a diffuse enlargement of the thyroid gland, whereas these two, especially painless is relatively small. And you've reached the end of my video.